Welcome to Marian Ayurveda. In this episode, we are going to discuss a condition called hypothyroidism. Hypothyroidism is also a disease that has increased significantly in this day and age. Hypothyroidism is a condition that has shown the most results or has been completely cured through our treatment. How can this be completely cured? By identifying its causes and providing treatment accordingly, we can completely cure this disease. There are about 7 causes that I am going to mention now. Once we understand which of these is the cause of our thyroid issue and address it, thyroid is a condition where you won't need lifelong medication. I am Dr. Anumod Kakkassery, Marian Ayurveda Thrissur. In my practice over a period of time, we have treated patients with TSH levels starting from 500. The first patient I treated was someone with a TSH of 150. That patient's treatment was done about 10 years back. That's when I treated that patient. That's where I started learning about the various aspects of hypothyroidism treatment. We are now going to start by talking about this cause first. I have mainly identified 7 causes for this. The first cause among them is acidity itself. We have often felt that in those with acidity, after some time, it leads to thyroid disease or hypothyroidism. So the first treatment I give is not for hypothyroidism, but medicine to cure acidity. For some, acidity might not be the cause. The second major cause I've noticed is allergic disorders. Allergy to dust or skin rashes and itching, sneezing, persistent sneezing. In those with such AL allergy issues, thyroid problems have been seen to increase rapidly. In them, when we provide treatments to cure the allergy, we see the thyroid returning to normal levels. A third cause within allergies itself, a major thing is if we eat a fish called prawns. In those who eat prawns, I recall a patient, that patient's TSH was 175. After that, we treated them and it reached about 0.6. Then suddenly when that month's result came, the TSH had risen to 350. Then I thought if it had decreased this much once, the disease should have completely subsided along with it. When I investigated why it increased like this, I realized that 2 days before the blood test, they had cooked 1 or 2 kilos of prawns and ate prawn curry for 2 days. That single factor of prawns alone increased the TSH, which was at 6 to 350. What we understand from this is that the allergy caused by prawns, that is allergies in general, increase thyroid levels. The third major cause I've noticed is urinary tract infection. Especially in women, urinary tract infections are seen to be very high. In those with persistent urinary tract infections, thyroid functions are affected very quickly and the production of hormones is seen to decrease. This is something we see through many studies. Many studies have proven that there is an axis between the urinary system and the thyroid. So in many people, we can treat thyroid issues by curing urinary tract infections. In many people, as they age, their thyroid gland function decreases, leading to hypothyroidism due to gland fatigue. It is because the gland cannot function properly. So we can bring the thyroid back to normalcy just by massaging the thyroid gland with drops like Chirakkakkode 101. In other individuals, we know that the thyroid hormone is a hormone related to mental stress. In people who always have tension or anxiety, if the anxiety persists steadily, it is seen to lead them to hypothyroidism. By giving them medicines that reduce anxiety, we can bring this thyroid back to normalcy. Then a 7th group consists of those who are very lean and have a very thin physique, those whose intestines are very weak, who have indigestion problems, or are generally very weak types of people. In such people, thyroid issues appear quickly. By the end of adolescence or youth, they suddenly get thyroid disease due to gland fatigue. In such cases, we strengthen them with medicines that strengthen the intestines. We always aim to correct the metabolism. Disruptions in stomach function are what lead to hypothyroidism. So when we strengthen their intestines, we see their thyroid returning to normalcy. Similarly, the last thing we can mention is indigestion. That is, some individuals cannot digest anything they eat. For instance, those who eat things like biryani regularly, or many nuts, or anything that doesn't digest or get gas from potatoes or cassava, it means they can't digest it. This is a type of thyroid issue that occurs in those with low digestive power. We give them medicines to increase digestive power. Also, when there are worm infestations, digestive power gets disrupted. When deworming medicines are given, the digestive power improves significantly. Their thyroid then returns to normal. So, what I'm saying is based on many things I've gathered from my 10 to 15 years of clinical experience, when treating by looking at the causes like this, 95 to 98% of thyroid diseases, specifically hypothyroidism, can be cured with medicine alone without hormone supplements. We will see you again in another episode. Thank you.